The heart is a double-action pump of ingenious design. It is the engine that drives the human machine. The heart and its network of blood vessels keep every part of the body supplied with a steady stream of life-sustaining oxygen. The oxygen enters the bloodstream through the lungs on either side of the chest. The heart takes in this oxygen-rich blood through the left atrium, the top left chamber. It flows down to the lower chamber, the left ventricle, and the ventricle pumps the blood up and out to the body. Empty of oxygen, the blood returns to the heart through the right atrium, passing into the right ventricle, which pumps the blood back to the lungs. These tendons in the heart's inner walls are attached to muscles that contract to regulate the amount of blood flowing through the heart. Valves open and close, blood enters and exits, creating a familiar rhythm. But what keeps the heart on the beat? Even when taken out of the body, an isolated piece of heart muscle will pump without any signals from the brain or nervous system. Here's another. And more. But how can all these muscle cells, each capable of independent action, work together in the heart in perfect synchronism? The secret lies with the heart's spark plug, the sinoatrial node, called the SA node. It is located at the top of the heart. Its signals are picked up by the AV node near the ventricles. Left to their own devices, the muscles of the heart would only beat about 40 times a minute. But the SA and AV node send out electrical impulses that synchronize the beating and boost the heart up to a more normal speed, which is about 70 beats per minute, 24 hours a day, 365 days a year. Here we see the entrance to the coronary artery, where the blood enters to fuel the heart muscle itself. Only 10% of all oxygen taken in is used to keep the heart pumping. Any muscle can cramp if its oxygen supply is cut off. For the heart, that cramp means a heart attack, a devastating result of a blocked coronary artery. This is the top of the heart looking down into the aortic valve. Here is the entrance ramp for the blood's main highway. Oxygen-rich blood is launched up and through the aortic arch, setting out to reach the rest of the body. For the heart to do its job, it requires oxygen and nourishment. That's where the coronary arteries come in. Coronary, from a Latin word meaning encircling, the coronary arteries are the blood vessels that encircle the heart. They are vitally important to its well-being. Coronary artery disease is a condition in which the arteries of the heart become narrow, usually a result of being clogged with a fatty substance called plaque. Your doctor might also use the word atherosclerosis to describe the process. Since the heart is a pump, it's made of muscle called the myocardium. The heart muscle, or myocardium, contracts, causing the heart to beat and pump to all the tissues of the body. Blood vessels encircling the heart, called coronary arteries, deliver blood to the myocardium. Inside the coronary arteries, blood carries oxygen and nutrients, which the myocardium needs to function. Coronary artery disease begins when fat, cholesterol, and minerals in the blood are deposited in the artery wall. These deposits form fatty streaks which may develop into plaque. The process can occur slowly over a period of years, but eventually the artery may begin to close. The flow of blood is constricted, and the heart muscle doesn't get enough oxygen, a condition called coronary ischemia. When this occurs, the patient may feel chest tightness or pain, a symptom called angina pectoris, or simply angina. A heart attack can happen if a blood clot called a thrombus forms on the surface of the plaque. If it suddenly blocks the flow of blood to the myocardium, a heart attack occurs. This is also called a myocardial infarction, or MI. It may result in permanent damage to the heart muscle. A heart attack, as you know, can be fatal and a frightening wake-up call. To review, cholesterol is a fatty substance that can deposit in the wall of an artery and may develop into plaque. This buildup of plaque can lead to a condition called atherosclerosis. Your doctor may refer to the blockage of the artery as a lesion. When less blood and therefore less oxygen get through to the heart muscle, you have ischemia, which causes a painful feeling called angina pectoris, two Latin words meaning choking in chest. You may have already undergone or about to undergo a stress test. The electrical changes in your heart can be recorded with an electrocardiogram, known as an ECG or EKG. Tests like these can give your doctor a more complete picture of the health of your heart. Often deciding how to test coronary artery disease requires inside information from coronary arteriography called an angiogram. The angiography is done in the catheterization laboratory or cath lab of a hospital. A catheter is a very thin tube. It is usually inserted into the artery or in the groin or arm. It is threaded through the blood vessels to the coronary arteries. A dye is injected that shows up on an X-ray, so your doctor can see what's going on inside the coronary artery. The angiogram shows how well the blood is flowing through the arteries. Because the dye seen in the X-rays travels in the blood, a normal artery allows blood to flow easily. On this film, you can see where the flow of the dye and therefore the blood is pinched off. You can't see the plaque that's closing the artery, but the interrupted blood flow reveals its location. In this way, your doctor can know precisely where your artery is clogged. For treatment, your doctor may prescribe one or more kinds of medications: nitrates or nitroglycerin to open the vessels, beta blockers to slow the heart rate, or calcium channel blockers to relax the muscles on the artery walls. Your doctor may also want you to take an anticoagulant to help prevent a clot from forming. And other drugs might be prescribed for lowering cholesterol levels or blood pressure. Medications cannot cure coronary artery disease, but for many patients, they can help control it. Thanks for watching, and I'll see you soon.